Dr. Blair kind of already covered this for all the paramedics. Um, this one is the simple finger thoracostomy and traumatic cardiac arrest. This is going to be a new skill for us here at AILC. I just wanted to go over the procedure real quick with everybody. Um, and I think it's good for the EMTs and advanced EMTs to know, at least kind of have a general idea of what we're going to do during this procedure. That way, if we ask for help, they kind of know how to help us. Um, the indication for this is cardiac arrest in adults or children as a result of trauma with the possibility of attention pneumothorax, i.e., blunt trauma or penetrating trauma to the neck, trunk, or extremities proximal to the knee or elbow. So there's not really any contraindications per se other than just obvious irreversible death. Um, so the equipment you're going to need is a scalpel, a large pair of hemostats, or a Kelly clamp, a permanent marker, chest seal, or a three-sided dressing. Um, so for the procedure, make sure you wear gloves and eye protection, uh, identify the cardiac arrest, and perform basic and advanced airway management, initiate fluid resuscitation, and control any external hemorrhage. You don't have to have any physical findings suggestive of a pneumothorax to perform this procedure. Most of those exam findings are pretty insensitive, especially in a cardiac arrest patient. If the mechanism of injury might cause a pneumothorax and the patient is in cardiac arrest, this procedure should be performed uh, without any hesitation. Okay, so identify the site. The best way to do that is to raise the patient's arm above the head and then identify the fourth or fifth intercostal space between the mid-axillary line and the anterior axillary line. If immediately available, you can splash some antiseptic on the skin, but cleaning is not indicated, or extensive cleaning is not. Dr. Blair said it best. The patient's already in cardiac arrest. That an infection is the least of their worries at the time, and they have antibiotics at the hospital to treat that. So your primary goal is to go ahead and relieve that pneumothorax, or the possibility of that pneumothorax. Use a scalpel to make an approximately 2-inch incision through the skin over the rib and following the contour of the rib. After that, insert the tip of your Kelly forceps and repeatedly open and close the tips while pushing in until you are touching the rib itself. Use the Kelly forceps to dissect upwards and to get between the ribs until you reach the firm pleura. This should be a tough and slightly elastic membrane that does not easily move when you dissect with the forceps. Close the Kelly forceps and push in with firm, steady pressure until the tip of the forceps pops through the pleura. You may or may not get a rush of air through the tract when you enter the chest cavity of the pleura. Spread the jaws of the Kelly open widely, and keeping them open, withdraw the curved forceps back of the tract and outside the chest. And then carefully insert your finger into the incision and advance it until you have entered the hole created in the pleura. Confirm that you can touch the lung and sweep your finger completely around the interior of the chest to ensure that you are in the pleural space. You've now removed the possibility of a tension pneumothorax, and if time and conditions permit, apply a chest seal or a three-sided dressing to cover the site, and then mark it with a marker or other device to clearly indicate it being an EMS-performed thoracostomy. I think one of the most important things to note in this protocol is that you make the incision over the rib, and then you move your forceps kind of over top of the rib. You don't want to go under, because that's where the vasculature or the neuro bundles are as well, and the vasculature, so you can cause nerve damage and have a whole lot of bleeding. The main concern in a traumatic cardiac arrest is if you did that would be bleeding and causing a hemothorax. So make sure you go up and over the rib. So and then seal it with a chest seal, and then if you have to re-decompress them, you can just open the chest seal and then put it back. Okay.